All right, good morning, everyone. If you've seen the other days of our overdose series, you'll know that I'm going to draw out this sentence as long as possible to give everyone a chance to transfer from the waiting room into the main webinar. So I'm seeing that number is still going up, so I'm going to, again, keep the sentence going. But good morning, settle in. We've got a wonderful final day of our series ahead for you. Okay, I think we can go ahead and get started now. The participant list is chilling out. Well, like I said, good morning, everybody. I am so excited for today. It is our final day of our 2024 Overdose Awareness Series. We've been doing this for, this is our 5th year now, and we are so pleased with how year number 5 has turned out. Now, before we dive into this session, before I introduce our fantastic panelists today, for this session. I want to go over housekeeping. Again, you've heard all of this before if you've tuned in earlier this month. But there, no more Pitch for Futures days to register for. But if you do want that certificate of attendance for today, please fill out that survey. We'll be posting it multiple times today. Go ahead and fill it out when you are done attending sessions for the day. So we'll get that in the chat box there. A plug for today's lunch session. It's going to be a little different. Rather than our networking breakout rooms, it's going to be one big room, and it'll be a big AMA for our medical toxicologists, our spies, those are our call takers, our specialists in poison information, and then with our educators as well. So if you have any sort of poison center related question, please join that session and ask us. Now, for today's session, for this morning session, like always, please ask questions in the Q&A box, and please post tech questions or share experiences or resources in the chat box. That'll make it a little easier for us facilitators to keep track of everything. All right, well, without further ado, let us dive in. Today, we're talking about naloxone in schools. Now, rather than me reading every bio of all of our panelists, I'm going to have them introduce themselves. So I'm going to start at the top of my list as I see it on Zoom. Annie, let's start with you.
Good morning. I'm Annie Hetzel. I'm a registered nurse, and I'm the School Health Services Consultant with the Office of the Superintendent for Public Instruction. Thank you.
Perfect. Thank you. Amy, you're next.
Good morning. My name is Amy Lutz. I work at Educational Service District 101 based in Spokane, and I am the public health coordinator supporting schools in our 7 eastern counties.
Excellent. Thank you. Representative Pollet, you're up.
Good morning, and thank you for so many people joining us today and for all the panelists. I'm Representative Gerry Pollet. I represent the 46th district in the legislature, which is north of the University of Washington to the city line. And I am a faculty member at the UW School of Public Health.
Wonderful, thank you. And as a personal plug, I am in your district, so thank you for representing. All right, and Dr. Buresh, you're up.
Yeah, hi everybody. I'm Chris Buresh. I am a pediatrician and an emergency medicine doctor, and I do some public health work as well. I'm my clinical work mostly at Harborview and at Seattle Children's in the emergency department, and I also am lucky enough to live in the 46th, and so it's really a pleasure to be here today. It's been a great series.
Excellent, thank you. And for those who've been with us for the whole series this year, you've noted that we've picked on Dr. Buresh a lot. We've bullied him into joining many of our sessions. So thank you so much for joining this last one. Okay, so folks, the whole point of today is a big discussion, a big Q&A session. We don't have slides we're sharing. We're not doing presentations. Now, myself and the other educators, we have plenty of questions we can ask, but this will be richest if we hear from you, from the attendees. So please ask those questions as you have them. But to get us started, Representative Pollet, I'm going to pick on you. Let's go ahead. If you can you talk a little bit about how we got to where we are now with naloxone in schools? Can you give us a little bit of an overview of some of the bill history there?
Well, it's okay to pick on me. I'm an elected official. so I'm used to it. In 2018, I had some constituents who came to me and said, we really need to address the potential for overdoses from opioids in high schools. And if you think back to the fentanyl epidemic, where this was pre-fentanyl height of concern. And it took it took 2 years for the legislature to respond and say, every high school should have naloxone to reverse opioids in the school. And it should be, and the legislature was lobbied by rural districts who said, not us, we don't have an epidemic. And so the legislature exempted school districts under 2,000 students. Fast forward to last December, the Washington chapter of American Academy of Pediatrics has a legislative meeting every year with the 46th district delegation, and Dr. Buresh was there. And Dr. Buresh shared what I had not ever heard before, the startling statistics about how many pediatric deaths, overdoses occur with a brother, friend, someone else in the room. And we sat there, and as I digested this, I said, what if we were to ensure that every high school student had access, free, no questions asked access to take home naloxone and have it in that room so that they could administer it and save a sibling or friend's life, and that we should extend that to every college student at a public college in the state having the opportunity to do so. And we put $475,000 in the budget for the high schools and the colleges to have naloxone available to distribute. And for the naloxone in the colleges, we estimated that we wanted 5% of the population to be able to access it, and we would use something else I had funded in the budget, which is the vending machines for 24/7 access to emergency contraception, which we're putting on every single public college campus. So that's the background, and I'll let Dr. Buresh talk about what the statistics were. But when I heard those statistics, I digested it, and I turned to the group and I said, what if? And we were able to respond to the what if this year, which was really fabulous.
Thank you, Representative Pollet. And Dr. Buresh, let's cue you up.
Yeah, well, it was a great meeting, and it was really so exciting to be a part of that and to just see all these kind of things come together all at once. And I think just what Representative Pollet was saying is true. I think across the country, we know that this is a huge problem. There's some really great studies showing that about 60% of kids that die of an overdose die with somebody else in-house. And kids, if you look at all of the folks that overdose, the young people are the least likely to be administered naloxone because people just don't have it. We know from some studies from Massachusetts that the more naloxone you have kind of blanketing the community, the lower the rates of overdose deaths are. And I think we had that experience. I live in Lake City, and we had that experience when we were out for ice cream one day. My kids and I all carry naloxone, but we were just going for ice cream, so we didn't have it with us. And somebody was overdosing across the street. And so we went over to help, and we were kind of, rubbing their chest really hard and trying to get them to wake up. And I dialed 911, but I also said to everybody around me, I need some naloxone. And within 3 minutes, I had 3 doses from bystanders. One guy rode by on his bicycle and sort of like a paper boy, kind of winged a naloxone at us, landed right at my feet. It was a perfect shot. And that's what we need, right? Like, if we're going to keep our communities safe, we're going to keep our kids safe. we need to have naloxone on hand when, when it's required, and we need to have people that know how to use it and are willing to use it. And so we know that in King County, where I'm sitting right now, kids are dying at a rate that's 3 times the national average of overdose deaths. And it's really one of the hot spots. We also know that of the 20 biggest school districts in the country, only 5 of them have naloxone available. And so I think this, what Representative Pollet is doing is really kind of leading the charge, and I think is really the vanguard of a movement to keep our kids and our communities safer. And so I'm really excited to be a part of it. Yeah.
Well, thank you both. And, I'm an educator with the Poison Center, and I have a public health background. So these kind of efforts just makes my public health heart happy. So I appreciate your work with this. So I have a question, another question, but I'll have this be for Amy and Annie. So as these policies were in the works, we'll start with you, Amy. What were some of your initial reactions upon hearing about this, about getting naloxone into the schools?
Sorry, Alex, did you say Annie or Amy?
Oh, that's difficulty of your names being so close. Let's start with Amy, and then we'll have Annie go.
Okay, and Annie will probably have a little bit longer historical perspective on this, but I think it's great. It's a needed resource that schools need. And we have a very rural area here outside of Spokane proper, and many of the districts, even before this current legislation, were already putting naloxone in their schools, even though it wasn't required. But in our rural districts, EMS could be a 30-minute response time, and that's not going to help somebody that is overdosing. So they saw a need for it even without the required legislation. And so it's a great positive step, certainly in the last couple of years and coming out of COVID. There's been a lot more awareness of fentanyl and overdoses, and people are eager to get the education and the guidance and putting in place their policies and procedures. And that's where the rubber hits the road, and how do we make this work in our districts? And I'll turn it over to Annie for some more historical information.
Thank you, Amy. Appreciate that perspective. And really the rural districts, something that, and my computer crashed in the middle, or my Zoom crashed in the middle. So I missed a good part of what Dr. Buresh said, but yeah, I've run into a couple of districts that say they don't have a problem, and those are the districts that worry me because I think no place is immune, right? So I started in this position 4 years ago. I'd been peripherally involved in similar work at the King County and Pierce County level when I worked at the Educational Service District there. But what really, I work with the school nurses, the school health side of things, and what started happening for me immediately after I started this job is nurses were contacting me from schools, and they were wanting to have naloxone in stock in their schools. They had the legal capacity, but schools were not set up like pharmaceutical purchasers. They didn't have relationships with vendors, and they were struggling to get naloxone. They didn't necessarily have it in their budgets, depending on the priorities of the district and the superintendent and the capacities. So there was a real struggle for schools that wanted it. Some wanted to stock it on school buses and on playgrounds, not just have 1 or 2 doses, 1 or 2 kits in the health office. They wanted it readily available. So that's when it really started to percolate up for me. And then anecdotally, I was hearing that overdoses were happening. So I work with the School Nurse Corps, which is a group of 9 regional school nurse consultants throughout the state that work with schools. And we've been gathering data on the number of doses of naloxone administered in schools since the law was passed. Thank you, Representative Pollet, for that, mandating that districts have districts of over 2,000 students have it in their high schools. And the first 2 years of the law, there were a few doses administered in schools, 2 the first year and 4 the next. And then in 2023, by the end of that school year, there were 48 doses that had been administered in schools that would, those are lives saved that would not have been saved if naloxone had not been there. So, and that just also raised all sorts of red flags, because I could see that the fentanyl epidemic was really hitting our youth in schools at that point. So that really got me much more involved in this work in the last year and a half, and more focused on really supporting schools around that. So I'm really excited for any progress we make on making this accessible. Now my focus is shifting to, although there's still the distribution and support for schools having stock is still uneven. So that is one of the things that I continue to push. Is we need more support for schools to have stock on hand so that trained staff can respond during school hours. I also firmly believe youth should have access to naloxone and should be allowed to carry it on their person, in their backpacks, because access at school means that they have access after hours. And that speaks to what Dr. Buresh and Representative Pollet were saying around, youth and children dying when there's someone else in the room with naloxone. But I will say that, and maybe I'll stop talking now and give some space to others. I have so much to say about this. It's just really been sort of the heart of the work I've been doing in the last year amongst my other duties. So I'll try to be quiet now, and we can talk some more later.
Thank you so much, Annie. And you absolutely don't need to stop yourself. The whole point of this is to share that perspective, and all 4 of you just have such amazing perspectives with this. Representative Pollet or Dr. Buresh, is there anything either of you would like to add to what Amy and Annie were just saying before we move on to our Q&A box here?
I just, I don't think we had that 44 dose figure during the session. I'm just, so thankful. That's incredible.
Yeah, I also think that data is really striking and important to kind of get out there. I think and amazing, and I'm really grateful that folks are taking the time to collect that data. And I think, I honestly, I think the people that don't think that there's a problem are naive, or willfully naive. And I think that a lot of the kids that are dying of overdose, they don't have opioid use disorder, right? Many of them are not kids that are habitually using opioids or who are addicted to opioids, but are kids who are thinking that they're taking, say, an Adderall that they bought off the street or something like that happens to be laced with fentanyl. And so having the naloxone in the schools is sort of an all hazards approach to this, right? So kids get something that is kind of illicitly laced with fentanyl, they're still going to be okay, right? It's not we put belts in the car for the same reason that we want naloxones in the school, right? It shouldn't be that one moment of inattention while you're driving ends your life. And it shouldn't be that the kids that take one pill that they got from a friend because they said it would help them with something is the thing that kills them. And so that's why we need naloxone. So I'm really grateful for that data, and that is fantastic. I'm looking for a map. The Washington State is an overdose map that shows the rates of overdose per capita, and if I can find that, I will put it in the chat for people to look at, because it is kind of all over the place. Yeah.
I'm sorry. I just want to say that data was shared on by several news outlets. There was a public records request, and we had shared already with a little bit, and then word got out. So I'm sorry you didn't have access to that data. I thought it was pretty widely available, but I certainly was shouting it from the rooftops as much as I could. So I appreciate that. And I will tell you that preliminary data for this last year is similar. So the other thing I wanted to share with you is I surveyed school nurses that year in 2023 to get more information than we normally collect. And I wanted to know who was stocking naloxone in schools. And I can tell you that almost a third of elementary schools had stocked naloxone out of all the, and only about a third of the schools responded to the survey. And it's amazing how many, to that question in the survey anyway. And I'm really pleased to know that even before the law was amended this last year to mandate that all schools have it, over 40% of high schools had it, 36% of middle schools had it, and 29%, I think, of elementary schools were stocking naloxone. So they saw the need in some places. And I think there's still stigma in a few places associated with having naloxone is going to encourage kids to use. And that's the shift we have to do. I think it's in very few places, but those really are impactful. So continuing to work on the stigma that naloxone does not necessarily encourage drug use, I think is really important.
Well,
Thank you.
it's disturbing to me to hear that every high school doesn't stock it when it's the law, and such a necessary response. We saw that the stigma argument exempting the rural high schools in the first year when we passed the legislation, but this year it passed unanimously with no one raising that issue again to expand it to those smaller school districts. And I thought we were past that.
I'm sorry, I want to clarify, that's 2023 data I'm talking about.
But you said in 2023, that was that's 3 years after the
all of the
high schools.
Sorry, there's a lot of tiny districts in our state. So when I'm talking about 30% of the districts, that included all of the what we call the class 1 districts.
Okay.
So I think for example, in Amy's region, there's Amy, about 60 class 2 districts of smaller. So that when you're talking about percentage, it makes it sound like not that many, but the larger high schools all had it in the larger districts.
Right.
Does that make sense?
Right.
And then last spring, we were actually, the ESDs, the public health coordinators, partnered with DOH to distribute naloxone to all public high schools to see the system so that everybody had at least 2 kits on hand. So at this point, every high school should have it. Right now, we're having an access issue for elementaries and middle schools that didn't have it before. Where do I get naloxone? And so those are some of the questions that I'm fielding because of course they all wanted for free. So just trying to make sure that schools are connected to resources to supply it at the other buildings.
Wonderful. Thank you all. And I love the rhetoric. Like you mentioned seatbelts, Dr. Buresh, and like seatbelts don't encourage us to drive faster. Like having antidotes don't encourage us to engage in these behaviors more. But they do help save lives. All right, so we are getting some excellent questions in the Q&A box. I'm just going to start at the top and work my way down. So this first one's pretty broad. Anyone can jump in on it as they'd like. How isolated are the schools in this? In general, are they connected with harm reduction locations in their community that provide naloxone to the community?
I'm going to jump in and say I think it's patchwork. It depends on the community, the relationships that the schools have with those harm reduction partners. And I think things are really shifting in the last 2 years. So it's hard, there's an increased awareness. There's a lot of work and attention being put on this. So, but we don't have data on that.
I would just echo Annie that it is patchwork, but also at the ESDs, we have community coalitions that our substance use prevention work is their focus and they're connected, and we try to make that connection as much as we can.
Thank you. Anything else to add, Dr. Buresh or Representative Pollet, before the next question?
No, I don't think so.
Perfect. All right. Next one. This is a bit of a data question again. So this is specifically directed to you, Annie. You had noted, oh, it jumped on me. There we go. You noted 48 doses of naloxone administered in 2023. Can you clarify if that was across all schools in Washington, or was that concentrated in any one region? And then further, any other details to share about if those doses were given by students versus staff?
So this was all over Washington State. I did not look at individual districts per se, but it was all over the state. I will tell you there were none documented or reported in the Olympic Peninsula region, which is not to say they didn't occur, but at least we didn't have any reported. I'm sure that there are, and I've heard from public health folks in that region that, you know, definitely there is an issue there as well. So, and it was rural as well as urban. It was all over the place. And then there was a second part to that question. I'm sorry, I can't remember what that was.
You know, bad moderating practice for me to hit you with a bunch of questions with no pausing. So the second portion was any other details to share about if those doses were given by students versus staff?
No, I believe they were mostly given by staff. And this brings up a topic that's near and dear to my heart. So if you don't mind, I'm going to elaborate. A lot of schools have not allowed students to carry naloxone or, you know, use it at schools. And that's one of the things that I've been working on for the last few months is to clarify policy on that. And as well as our guidelines coming out of OSPI. Previous guidelines stated that in order to carry naloxone at school, a student or someone who was not one of the trained responders had to have a prescription for it. As you can imagine, that was a huge barrier, and I'm working on removing that. But I want to say that in schools, response to overdose, I firmly believe needs to be done by designated trained staff, if at all possible. I've done a fair amount of community outreach, and I've talked to a couple of different youth forums asking them what they know about their school's preparedness to respond to an overdose. And it has been mind-boggling to me that the students, by and large, that I spoke to were not aware that their schools carried naloxone. And I feel like I worry that kids don't know that we're going to take care of them, right? It is the adults in the room who need to be there, and we need to let the kids know that we're prepared to respond. It's not enough to prepare to respond. They need to know that we're there to take care of them and that it's not on all of them. You know, as a school nurse in a high school back before I had this job, I remember students coming to me and saying, I was up all night with a friend in crisis on the phone. And, you know, those are the kinds of situations our youth are in on a regular basis. And my response to them always was, I'm so glad you were there, but it's too much for just you to carry on your shoulders by yourself. And here's some people who can help you. Here's some help, and, you know, whatever. So the point is, I don't want that be what's happening with our youth right now. I want them to have naloxone, access to it for after school, for when there's no staff on hand. But when we're at school, the focus needs to be on getting the adults to take responsibility and be prepared to respond and do that. That's my soapbox for today.
Thank you. Love the soapbox. Representative Pollet, you look like you were about to add something.
Well, and of course, the response to an overdose can't end with the administration of naloxone, which a student likely doesn't know. And so it's so important to, if possible, have it administered by a school nurse. I am eager to assist in any way necessary in regard to the ensuring that we can distribute naloxone and have students carry it on the campuses. So let me know. And I think everyone needs to weigh in on that, because we just need to get it out there and not, you know, have barriers. You know, we've provided $745,000 for distribution to high school students, and we did that on a data-based effort. The question was, how many doses should we try to get out into the high schools? And I looked at the Healthy Youth Survey data and looked at the recreational drug use. And it goes back to Dr. Buresh's point. A lot of the fentanyl overdoses aren't people who think that kids who think that they're using fentanyl. It's accidental use of other recreational drugs, and looked at what the percent was and applied that to our juniors and seniors. Not that they're the only area of students with potential use, but they're the most frequent. And so it basically said 5% of the juniors and seniors in high schools should have access to, no questions asked, naloxone.
Thank you both. And both of your answers set up this next question really very nicely. So that was well timed. So this next question: after a naloxone dose is administered, what services are students typically referred to? And are the services or systems post-administration adequate?
I'm sure the Poison Center has a protocol for that.
I mean, I can speak a little bit to how poison centers interface with opioid overdose data, but it is a little adjacent. So I'll I'll hold that for just a moment. If anyone wants to jump in, no problem. If not, I can go down a poison center rant.
I'll be honest with you, that's not my area of expertise. So, but my somewhat educated guess would be that, again, it is dependent on the capacity of the school to connect those students with follow-up. We always call 911 if an overdose happens in a school. So part of the answer dwells with the response at the medical center where the student is seen, hopefully afterwards.
Yeah,
And I'll
and so I can speak a little bit to that. Go ahead though, Amy.
Oh, I was just saying, here at the ESD, we are also developing handbook, playbook, toolkit, whatever you want to call it, for our districts with resources, mental health, substance use resources, forms for students to re-enter school, you know, depending on the situation, safety plan, communication. So kind of what happens after resources, and we're hopeful to have that out to our districts soon.
And then from a 911 standpoint, we do really encourage everybody to call 911 after an overdose, because in theory kids could become re-sedated. The naloxone only lasts for about 45 minutes, and depending on what they took, and a lot of times nobody really knows for sure what was in there, they could become re-sedated after the naloxone wears off. And so we really want people to call 911 so that we can watch them in the emergency department for a while. And then ideally in the emergency department, there's a discussion had about, what you were using, why you were using. Do you think you have a substance use disorder, or was this just sort of like, I wanted to do type situation? For people that have substance use disorders, we're really encouraging emergency departments to start medications for opioid disorder, specifically a medicine called buprenorphine, which we know cuts the risk of overdose death in about half for people that use. And we've got some HCA, set up some protocols to help people start that medication and get started. For kids that don't have a substance use disorder, we really hope we would, that actually there's a law that says that we have to discharge them with additional naloxone, and then hopefully they can get connected to crisis resources and other sorts of supports in their community, kind of wraparound supports to help them. I'm just going to put in the chat this Washington Recovery Helpline. I think this is just a good resource for people to have as well. The Washington Recovery Helpline, there's a website, there's also a phone number, and anybody can call. The people that work there are amazing and can help folks find resources for counseling and medications for opioid use disorder or any substance use disorder. And it's available 24/7. And I just think it's an incredible resource.
Thank you. Thank you for sharing that resource. And thank you for everyone weighing in on that. I'll very, very briefly, because it's not about me today, speak to the Poison Center's role in all of this. So typically we encourage folks to call the Poison Center in any sort of poison situation, providing the person they are calling for is conscious, is responsive, is breathing, and is not having a seizure. Now, as we all know, with a potential opioid overdose, that patient is very likely not breathing and not responsive. So in those situations, we really encourage folks to bypass us and call 911 directly. That doesn't mean we're not involved with opioid overdose cases. They just typically tend to be patients who are already set up in the hospital. And in those cases, the hospital is contacting us for that additional oversight. Now, that tends to happen in more novel exposures, such as pediatric exposures, infant exposures to fentanyl, or more complicated exposures. So one patient who's been exposed to multiple different substances all at once, and some of them may have been opioids. And then the Poison Center will help that hospital account for potential interactions and give our recommendations on the treatment plan there. Yeah, I'll stop there though, because again, it's not about the Poison Center helpline for this particular conversation. Now, anything else before we move on to our next question? Okay, excellent. And a bit of a tech test. Representative Pollet, are you able to hear us okay? I saw you glitched for a second and came back on.
Good.
All right, perfect. I saw the head nod, so I think we're good. Okay, next question. Is there a website where the school nurse core data or school nurse, not sure what you mean by core, data about naloxone and overdoses in schools is being published?
So it is the school nurse core.
Okay.
No,
Perfect.
well, let me backtrack. It is not available on our website. But it was published multiple times through media outlets. So, and it's been a while. It's been over a year. So I don't remember off the top of my head. I believe King 5 was one of the news stations that carried it as a segment. But I believe there was also some print articles, and I can send those to you, Alex, after this. Well, after today, it won't be this afternoon, but so you can share with the audience if possible. But it was published in the media.
Wonderful, thank you. And that goes for all of our panelists and our attendees. If you have resources you would like us to share, A, please put them in the chat box as you have them, and B, feel free to send them to us after the fact. Now, as we're getting all the recordings and the materials gathered for each of these sessions, we're going to embed them all in our website. That'll include resource sheets specific to each session. So thank you so much for adding that, Annie. And apologies, I don't know why the term core threw me off there, but coffee's slowly kicking in, so we're getting there. All right, so next question here. Whatcom County schools are champions of having naloxone on site, but how do we get the rules changed for allowing students to carry without needing a doctor's note?
So I'm working with the Washington State School Directors Association, which sets model policy for all school districts in the state. We are a local control state, so there's no mandate at this point for allowing schools to allow students to carry, but we are changing the model policies, which is fairly influential with school districts. And we're also changing, we are revising. In fact, I just finished yesterday and submitted for approval a revised guidelines for schools that will state that it is up to districts to set individual policy about that. So you can advocate with your school boards and your school superintendents to change policies like that. I will tell you that for the most part, what I hear anecdotally is that schools are sort of taking a don't ask, don't tell position about that. But I will also tell you that I know of at least 2 instances in the last 2 years where students were found to be carrying naloxone, generally because there was some other disciplinary issue. But when they were found carrying naloxone, it was taken away from them. In at least one instance, students were disciplined for having it. That's what I want to do away with. There is no legal requirement to allow students to carry naloxone in schools at this point. I'm hoping that with policy and guidance, we can take care of that problem in those few isolated cases of where it was being taken away. I never want to see that happen.
I would say, if I can join in, Alex, that it is very disappointing to me to hear WASDA has policy is an obstacle. It is not WASDA, the State School Directors Association doesn't adopt laws, as you said, and the state budget requirement is, I believe, essentially binding. The language in the state budget is $345,000 of the opioid abatement settlement account is provided for the Department of Health to purchase and distribute naloxone for barrier-free and cost-free distribution to high school students. So since there's no legal barrier, I think the state legislative direction is very clear, and the districts need to have programs in place. We were asked during the session, would districts, accept that, and proactively go forward? And the Department of Health said they would be contacting the districts. But no district said that, oh, we don't want to distribute naloxone to high school students during the budget process. And so it's kind of disconcerting to hear that there may be some resistance for the distribution.
I'm not sure that there is. I just know that there's a couple of cases where naloxone was taken away from students for sure. And so I'm trying to address that piece. I did use the fact that the legislature funded naloxone distribution in my arguments for changing the policy. I'm not getting resistance from them on that. It's just a matter of pushing it through and getting it adopted and all of that. The part that I cannot control is what districts choose to do with that policy. So, and it honestly had not occurred to me that the law and the budget would be binding. I did not look at that law. I tend to focus on the RCWs that we work under. So I appreciate you calling that out, because that's a really important point.
It's not the same as a statute, but it is, in the absence of a contrary statute, it's very clear policy direction from the state. It's great to hear that there isn't resistance, and we just have to work through this. Frankly, we have this, we're very concerned that we want to make sure that, we've talked about the high school students. We have to do the same thing in all the public colleges and make sure that it gets out there. And I will say that the manufacturer of Narcan contacted us and offered during the session, as they did in 2019, to provide free doses very supportive. So in terms of the cost, we've got money in the budget, and I know many districts took advantage of the free doses offered when we started in 2019. It's so inexpensive to do. The cost is not a barrier.
All right, thank you both. And as I feel like in general, proper moderation means I don't weigh in on things, and generally I'm going to stick to that. And I just have to take my moderator hat off for a second and say how frustrating and disappointing it is to hear that the cases you just said, that there are students who are being penalized or at least had the naloxone removed for trying to help their communities. And I'm appreciative that y'all are working on that so hard. All right, moderator hat back on. So I'm seeing a couple different questions that are kind of getting toward the same thing, and it's really amounting toward how are parents reacting? What are some of the parental reactions you're seeing? Parental resistances or support? An additional question I'm seeing here onto that is, are we seeing, or do parents have to provide permission for students to carry naloxone? And you all have kind of touched on various aspects of that, but is there any more on parental reaction anyone would like to add? I saw a big head shake from Annie, so that's super fair.
Now, I've not heard from any parents. This is where having school staff here, and I know it's a start of school in many places, so it's really difficult for them. But personally, no parent has called, and I do get angry parent calls on a fairly regular basis. I've not had any about that. I have heard that parents are providing naloxone to their students, not because they're concerned about their own students, but they hear the stories in the media and they're purchasing naloxone and asking their own children to carry it just in case.
I would just weigh in, and we haven't heard any resistance at either. And something that Dr. Buresh said, it's another tool in the emergency response toolbox that schools need to have, right? We have AEDs there. We have emergency operation plans for anything from tsunamis to earthquakes to intruders. So I think this is having naloxone on hand is just another tool to respond to any emergency that could happen on a school campus. And so that's why the districts and the schools need to have those trained responders. Like Annie said, they have to have their policies and procedures of who calls 911, where the naloxone is stored, how do we respond to an emergency. So we have not heard anything, and I think the landscape has certainly changed in the last couple of years about fentanyl and that awareness for everybody. So my 2 cents.
Yeah, I would just say, one of the things that Annie's data, I think, highlighted for me was that we're way more likely to use naloxone in schools than a defibrillator, right? And so I think that it is really important. And like Penny said in the chat, I mean, my kids all carry naloxone, and I think, it helps them feel sort of empowered to step in and to be a good friend and a lifesaver. And it is just an amazing opportunity for us to have a conversation about, hey, this is out there, this is important, and this is risky. We don't live in a time where you can just try something without, it's not like it was in the 80s where you try something, get away with it. It's dangerous, and so having that naloxone there is just an opportunity to open a door to a broader conversation about substance use and experimentation and ways to stay safe. And so I think it is really great. And I would say in the emergency department, at least, we also haven't had any pushback from parents. We give it out pretty broadly for anyone who's had any kind of substance use, like even marijuana or whatever, which is like, hey, just take some naloxone. It's not for you. And I think it's also important to tell kids, like, when you're giving them naloxone, that you can't reverse your own overdose, right? So this is not for you. It's not going to help you. It's for your friends, or it's for someone you might run into. And so, so I think I haven't seen any pushback either.
I think it's important to call out that we have significant number of youths who are not just concerned about their friends, they're concerned about family members. I've heard in some communities of families losing multiple members. And our kids, our youth are facing so many barriers and stressors that if we can do something to support them in this and help them be there, it's really important to empower them. So I appreciate that.
Well said, everyone. Quickly sharing some anecdotal evidence to this as well. My colleague Justin, our Eastern Washington educator, is saying that when we, as the Poison Center, when we do distribution and education events around naloxone, we very frequently get teens with their parents, and their parents are very actively supportive of their child having naloxone on hand. I'm seeing a comment in the chat box, someone saying they have a 15-year-old and they had him watch the video and he carries naloxone. So yeah, just love seeing all that support. All right, so moving on to the next question here. Are rescue breath masks being given out with the naloxone in schools? All right, uncertainty
I
there,
think
no
it
problem.
depends
Go
on
ahead.
where it comes from,
Sure.
who's providing the naloxone. Are they purchasing it? Is it coming from the local public health jurisdictions have increasingly, I think they're using some of the opioid settlement monies that they're getting to provide kits for schools. So, I'm hopeful that that's something that we're going to see more of, and that those partnerships are being strengthened further as they were during the pandemic, but around this other public health emergency.
All right. Now, I think everyone here at different points has kind of touched on this and some of their other answers, but I'll ask it directly here too. Can anyone here speak to some of the outreach in smaller rural counties in specifically Eastern Washington is what's called out in this question, but I like the pointing there, Annie. That was good.
Well, she's over there, but on my screen it's backwards. So I'm pointing at
There
Amy because
you
I know
go.
that's her expertise there.
Thanks, Annie. Yeah, outreach for education or just, distribution of naloxone, all of those things. I partner with our local health departments in the Eastern Washington counties, and we are sharing as much information as we can and providing resources and providing connections to school districts in rural counties, because we know just can be a problem anywhere, and overdose can happen anywhere, but also, like I said before, the response times can also be quite long in our rural counties. So we are working on it, and like everything else, it is a patchwork across the state with resources as well. So yes, we are.
All right,
Yeah,
excellent. Thank
Seattle
you.
Children's has a community. Oh no, I was just going to say that Seattle Children's has a community outreach sort of branch that is also working on getting out into more rural communities and some tribal communities to talk about naloxone. They started as kind of a firearm and violence prevention effort, but have pivoted in the last 12 months or so to really focus on naloxone as well. And so we're trying to get out to more rural areas and some of the tribal areas as well.
One thing that comes to mind as this conversation evolves, I think really it bears highlighting, is that I am seeing unprecedented collaboration and coordination between state agencies and communities right now. Our agency, we have multiple people working on this, and we're having conversations with the Department of Health intensively. We're having conversation with the Healthcare Authority folks who are working on educational materials. We're having many conversations with tribal communities and a tribal work group on prevention and education for youth. So there's just a lot of connecting that's happening to try to be more comprehensive and coordinated across the state and to reach all communities as much as possible.
Excellent. Thank you. Okay, now it looks like the Q&A box is running out, but don't worry, we educators came up with quite a few questions for just such an occasion. So I've got a really big, broad one for you, and I imagine Representative Pollet will have something to say about this. Now, how should we center youth in policy decisions that directly affect them?
Well, great question. Thank you. I'm a believer in the principle of nothing about us without us. And that means whether we're talking about persons with disabilities or students, we need to seek out very actively their views and involvement. And, high school students around the world have changed the world. Shouldn't think that they can't have a say in policy, and they certainly did in helping us to start the ball rolling about naloxone in high schools. And it's a matter of outreach. Some school boards have a student elected or appointed participant on the school board itself. It's a ex officio member. Seattle does, and it works well. So that's the type of voice that we need to have when you're talking about policy of, adults who are maybe parents and or educators who, listen, I've been there. I didn't know exactly what my kids' friends were actually doing in high school. That was different from when I was there. So having that voice is vital in developing policy, and we invite them eagerly to testify via Zoom and talk to legislators.
Excellent. Thank you, Representative Pollet. Is there anything the other three panelists here would like to add to that? Okay, seeing some head shakes. Sounds good. Okay, another question in the Q&A box here. Do you see a difference between the west side of the state and east side of the state in adoption of these resources? You've talked a little bit about different outreach approaches, but the question continues to say, is there specific outreach approaches that seem to work in conservative districts? And I'm guessing, it's going to be a little more of that patchwork answer, like it so depends on the area.
I have to say, before there was any mandate for schools to carry and to stock naloxone, it was a rural school district. I believe it was Toppenish that was the first one in the state to have a policy. They created it from scratch because none of the 8 normal agencies had anything in place. So there's just no rhyme or reason to it, and we don't really have any kind of data to look at to see what works and what causes one district to adopt something versus another. I will tell you that, my guess is that those districts where they're connected to the community and they see things happening in the community that are impactful, there's nothing like having a serious incident to spur districts on. Unfortunately, that's the way we work generally, but.
Yeah, I agree. I mean, you hate to have a catastrophe or a tragedy sort of be the thing that has to launch people into action. I've talked to some friends that live in more conservative places. And I think a lot of times it's just sort of exposure to this. I talked to a friend who's set up 2 vending machines in very rural places in Washington that carried naloxone vending machines. He said at first people were really pretty upset about it, but once they realized that it didn't cause the whole community to fall apart and everybody didn't start using drugs just because naloxone was available. And they had some conversations. I think in rural places, people are, people of course have their sort of social and political standpoints, but they're still neighbors. And there's still people who live, care very much about those communities, and so I think sometimes it's just a matter of exposure, and recognizing that although this is new and it seems like it could, potentially be dangerous or encourage people to use drugs, once you see how it works and you see how people react to it, I think some people tend to calm down a little bit. But it is sort of getting over that first hurdle that is tricky.
And that's where the importance of local connections and community partners. I mean, OSPI and the legislature and Department of Health can have recommendations, but how those things play out on the ground are the most important. So who are your community partners? Who are your community advocates? Representative Pollet mentioned students. They're very knowledgeable about what's happening and great advocates. So it's pulling those people together that live and work and play in that community and say, we want this community to be safer for everybody. And what do we need to do to make that happen?
Something I'm hearing from all of you at different points in this conversation is the power of community and community building and equipping individuals, whether it's schools or folks in schools, whether it's parents, whether it's students, to help their community. And that seems to be one of the most powerful ways to help. And so I really appreciate hearing that kind of community perspective here. All right, I'm seeing a question from one of my colleagues. What recommendations do you have for parents to talk to their teens about fentanyl or other opioids?
I can tell you what the approach I use, and when we do a little bit of school education and outreach and talk to parents. The approach I usually use is talk to them about what their friends are doing. We know the kids that are more likely to experience around other people use drugs, and if they have friends that are experimenting drugs, it makes it a little bit more likely that. But even if they don't have friends that are starting to use drugs, just asking about it and then starting that conversation. What if, let's hypothetically, what if your friend were to offer you a pill? Like, how would you respond, right? Or and just talking through some hypothetical ways. And I think letting your kids know that it's very that your expectation is that they will use something, but also that if they ever be talk to you about something that you're there for them, if they have questions.
Dr. Buresh, you broke up just a little bit, but I'll try summing up what you said, and please correct me if I'm misrepresenting that. But I think a lot of what you were saying came down to like speaking. Oh, and you're coming back in now. Excellent. But speaking to your children about hypotheticals, about scenarios, posing different scenarios, and at the same time discussing like your own family expectations, your own family boundaries, and all of that. Dr. Buresh, are you back on?
Yeah, it's like, hey, and so let me stop my video. Let's try that. Can you still hear me?
Yeah, I think you've cleared up a bit now.
Okay, I'm gonna just leave my video off. That'd be too much bandwidth. Yeah, no. So I think that's most of it. Is that not only do they understand that there's expectations in your family for them, but that you're a safe resource for information, and they can talk to you about this stuff. And if they slip up, you're not going to fillet them, right? Like that you're there to help and to help keep them safe. And my kids know that there's no questions asked. See if they need me to pick them up from somewhere overnight, and drive home. And so I think that's important. I also put your Washington Friends for Life link that I think has just really, really amazing resources for how to talk to your kids as a parent about this stuff. And so I encourage people to check that out.
Perfect. Thank you. All right, so we've got just about 10 minutes left. So again, folks, please ask questions as you have them, but if not, I can ask my questions. So this is a shift in direction a bit, but poison centers are super duper aware of the importance of terminology. We have the term poison literally in our name. And that has a lot of implications. And, we've been coming across a lot of media, a lot of discussion, a lot of rhetoric on this idea of substance poisoning versus substance overdose. And we have our own kind of technical differences there between both terms. But for all four of you in your work, what's the kind of rhetoric you've come across with the differentiation between poisoning versus overdose? If any, it's totally fine if you have no differentiation there as well.
I'm sorry. I don't want.
Please,
Go ahead.
you're the expert. Dr.
I would just say that in my world, poisoning is when somebody gets something that they were not intending to take, that hurts them. Whereas overdose is they took something but took too much of it, and it leads to bad things happening. And so it really, I think, it kind of hinges on what what they thought they were taking and what their intention was when they were taking it. But that is my kind of layman's idea, and I'd love to hear other people's thoughts.
I was going to say that tracks exactly what my students in their self-directed problem-based learning program MPH students would say is the difference.
Yeah, and
there is a
please.
stigma. I mean, and that's one of the other things that we just have to recognize is the word overdose has stigma associated with it.
Yeah, and that's a lot of what we have come across. You know, I've seen like New York Times articles on this very topic of folks advocating that if someone they know has died of a substance overdose, that it be labeled as a substance poisoning because of the difference in perceived stigma there. And it's tough because we in Poison Center, you know, putting my Poison Center hat back on for a second, we take a super duper broad approach to this term poison, and we try to remove intentionality from poisoning and overdose. And I can go into all the technicalities there, but I'm starting to see that we're losing some of the attendees. So I think it's probably good that we've moved toward our wrap up portion. With our last few minutes, I'd like to ask all of you. You know, we've been asking pretty much every speaker in our series today, or this year, I should say, excuse me. For viewers of this session, what is the action you'd like them to take? What is the single takeaway? If it was a single takeaway, what would you like that to be?
I know there are people who are going to watch this from other states, and I hope that our policies can be borrowed and put in place. You see, we've discussed the evidence basis for these policies. They're very strong, and we're available to help you with developing a policy for your state.
Excellent. Thank you, Representative Pollet. Our other three speakers, any final thoughts you'd like to convey for folks, or action items you'd like them to take?
I'll jump in. I'm struggling between two, and so I'm just going to mention both. And one is, you know, I know that Representative Pollitt said naloxone is not expensive, but school districts are really strapped for money this year. I'm hearing of districts having laid off school nurses not because they wanted to, but because the funding just, you know, it's been a bad year for us in Washington State for some of the districts, not all of them. So just a consistent source of immediate replenishing of school stock is just really primary on my mind and has been for some time. Because while some districts have ready access, the money's not necessarily there to buy it at the pharmacy. And some of those rural communities don't have a pharmacy. I heard of a district last year that used all of their doses in one day on one student. And then they were panicking because they couldn't immediately replace their stock. So I don't want that to be an issue for districts. I want them to know exactly where they can go and get it right away. But really, just to move away from that topic, I just think we need consistent support for schools to have it. And then just don't make assumptions that kids know what we have in place. So having those conversations with our youth children about what schools will do to take care of them, but then making sure that that's really what the school is doing. So having those conversations and seeking that information. And if you have kids in school, have a conversation with the school nurse or the principal or the superintendent about what their response plan is, and then make sure the students know.
Right, thank you. I also totally respect the approach of like, well, it's hard to pick one, so I'm going to give you two. I operate off that all the time. All right, now Amy or Dr. Buresh, any kind of final action steps for folks?
I will echo Annie's access issue. It is although it's not expensive and it's over the counter, it's still an issue for schools, especially when they have multiple buildings. So I won't go on that. But I think that the action item is just having conversations with everybody, doing training of staff. You might have a small group as the designated responders, but there's no reason you can't train more people in your staff, because people have questions and there's misunderstandings and there's myths out there about exposure and other things. And so the more conversations that we can have, the better to reduce the stigma and also to prevent overdoses in the future.
Yeah, I think that's so true. And I think, I think my kind of maybe two things also would be, yeah, I mean, everybody should be carrying naloxone. Everybody should just have it with them. I think everybody on this call hopefully has naloxone that they carry around with them. And if you don't, you should get some. I think, I actually, I know that the numbers always look bad when you look at the overdose deaths year over year, and both for adults and kids. But I think we have an opportunity to really turn the tide. We have more access to more tools for this than we've ever had in human history, right? We know naloxone is incredibly effective. It's easy to administer. There's no side effects. So you don't have to dose adjust it for size, or if people have kidneys that don't work or whatever, you can just give it. You don't have to think twice. It's easy, it's straightforward, and now it's available over the counter, which is kind of a new and super cool thing. And so I think, doing the work that Amy and Annie are doing with educating and making sure that it's funded and available, like Representative Pollet has done, is, we have a chance to really do something that we've never been able to do before. And I think we now have shown that we're developing the will and to do it, and to put our money where our mouth is, right? I mean, our kids are important. And so I think I just feel really grateful to be a part of this group and to live in a state where we have spoken up and are really leaning into this. And so it's very cool.
Absolutely. Goodness, I am so appreciative to all four of you. And in sessions like this, panels like this, for me personally, bring me a lot of hope, because there is, it's like what everyone here has been saying, these numbers can be really overwhelming and really heartbreaking. And we are seeing ways to fix it, seeing ways to help, to make it better. So thank you, all four of you, for the work you're doing and for taking time out of the work you're doing to join us today. Very, very appreciative to all of you. Now, folks, if you're still on the session, please join us for our next session of the day, supporting recovery, treating alcohol and opioid use disorders with naltrexone. That will be at 10:30 this morning, so 17 minutes from now. Just enough time to get another cup of coffee, take a bio break, and rejoin us. Now, again, keep an eye out for the survey we're going to bombard you with multiple times a day. And if you have any other resources you'd like to share, please contact the educators here at the Washington Poison Center. We'll be sure to disseminate that out to everyone. Now, thank you all again for joining. Thank you for speaking, and thank you for attending. And I hope to see everyone, as many folks as possible, in now 16 minutes. Take care, everybody.
Thank you so much.